Keeping your hands clean is one of the most important steps you can take to avoid getting sick and spreading germs to others. So be wise and wash your hands regularly to keep those germs at bay. Get more tips for healthy living by tuning into Kaieteur Radio every Monday at 1:05 p.m. for your health matters.
Good afternoon, everyone, and welcome to another edition of Your Health Matters here on Kaieteur Radio. I'm your host, Rihanna Ramsey, and today we will be discussing the Delta variant of the COVID-19 virus, something that even as people have begun to feel some hope, at least a cautious optimism earlier when the pandemic began to recede, there was a threat of a new mutation of the virus. And that brought with it a mighty amount of worry and a highly contagious SARS-CoV-19 2 virus strain, which was identified in India first in 2020, in December 2020, and then it swept across Great Britain, Latin America, and the Caribbean. Guyana is one of those countries that has been seeing an increase of the virus and deaths as a result of this predominant variant. Today we have with us Dr. Zulfikar Box, the head of the emergency medicine at the Georgetown Public Hospital. Good afternoon, Dr. Box.
Hi, good afternoon, Rihanna, and good afternoon to all the listeners.
Okay, and we will, Dr. Box is on the ground and he's usually very busy. We're glad to have him today. He took some time out of his busy schedule to tell us more about this virus and what we should expect and how we should be dealing and treating with it. So let's discuss the variant, Dr. Box. What does it mean when we're contaminated with the Delta variant?
Well, the Delta variant by itself, as you rightfully said, it's a new form of a more fitter and more efficient form of the SARS-CoV-2 virus, or the coronavirus more commonly. And it infects us easier than the previous versions. What that means for us is that a higher number of people will be infected with it in a population. And if there is a higher number, the chances of people being hospitalized increases also. And what they're finding, the data has recently stated, is that it tends to affect the younger population more, and the severity of the presentation tends to be earlier than the previous versions of the coronavirus. So those are some tidbits that will give you an idea of what we are dealing with.
And that means that we would see a higher viral load in a person who's contaminated with that variant.
Yes, actually, they did a study in China, and what they found that persons who were infected with the Delta variant, they emit 1,000 times more viral load when compared to those who would have been infected with the original version of the coronavirus. So the viral load is very high, and because of that, the risk of infecting others is extremely high also. It is actually what the data has found is that the more threatening variant before this was the Alpha variant that came out of UK. And that was about, the Delta variant is about 50 to 60% more efficient in infecting people than the Alpha variant. And when compared to the first variant, the first strain of the COVID-19 infection in SARS-CoV-2 virus, the Delta variant is about 2.5 times more infectious. So you're talking February in 2020 to now you have a virus that's circulating. That's 2.5 times more infectious than the one back when the pandemic started.
Wow. You're on the ground, and there has been an increase in the number of cases coming in. At Georgetown Hospital, can you give us a description of what was going on there at the emergency unit in terms of managing?
Tough environment to be in currently. I mean, you would know how long you've been trying to get me, and it's a very, very difficult time for us as health workers, and also for the patients. And the worrying aspect of it is that since the pandemic started to now, this has been the most disastrous period for us, and it's taken a toll on everyone. No one in the health field who works at the emergency or works with COVID patients in the hospital will tell you that they're happy coming to work. No one wants to come to work anymore because you're just basically battling with making decisions on who's dying and how to help so many persons that are so sick at the same time. And in addition to that, our non-COVID load has not decreased. So it's dealing with two population of patients with the same amount of staff that we would actually is lesser amount of staff than we would have had before the pandemic. And as you know, Guyana would have been short with healthcare staff before the pandemic. This is not something that's a secret. So and since the pandemic started, quite a bit of healthcare professionals, demand for healthcare professionals increased worldwide. A lot of migration and attrition has occurred because of that. So we're dealing right now in the worst phase of the pandemic with a higher load of patients who are dying more with a lesser staff complement. Because of that, it's a very tough environment to be in. And what makes it worse is to see that persons who are dying, overwhelming majority of patients that are dying, it's because of the choice they made when it came to vaccines. And that hurts because, you're looking at people there's some of them who are begging you for vaccines now, but you can't give them because really and truly the vaccine takes time to work. And if you give vaccines when people are sick, it's not beneficial to them. And that's the difficult part of it, is that you have to come to work daily seeing people who made choices that weren't informed properly are suffering and dying. And because of this variant that's more efficient in killing people, you have to do, there's only so much you can do. And I mean, I'll tell you, some of my staff do 3-4 resuscitations, and a resuscitation can go up to an hour in a shift. So by the time you're finished, you're busted, you go home, you rest, and you're back the next day doing the same thing. So it's a very tough environment, but we're committed to trying to save as many lives as we can. That's what we've been trained to do, and we're trying our best under the circumstances.
On average, how many persons do you see coming in that would be like COVID infected or have that? And how do you determine who stays in the hospital? Because I know there's a limited amount of space and what's not. Who stays, who's admitted, and who's not?
Yeah, it's a tough thing because the expectation is that yes, patients will present, and some will come with symptoms of COVID, and some would come without COVID symptoms, and it's easy to delineate. It's not. We've seen patients who come with heart failure, and their heart failure was a result of the infection from COVID. So you're treating them in one space with a non-COVID disease, and then because of some suspicion, you test them and they become COVID positive. So our load generally, in terms of testing for the day, we would average about 20 new positive cases that we're testing. However, we are the National Referral Hospital and National Referral Emergency Center. So in addition to the ones we test, we're also taking care of patients that are referred to us from either private facilities or any other facilities in the country. So that I can easily estimate between close to about 50 patients a day with COVID-19 that presents to the Georgetown Public Hospital that we have to take care of. And that is because one of the things is that none of the private hospitals actually manage COVID-19 patients. So the challenge of the burden of taking care of COVID-19 patients in Guyana rests quite largely at GPHC, the emergency department, and of course, GPHC that runs the COVID hospital. So on an average, I would say about 50 cases daily that comes for care.
And that's COVID cases? COVID
cases. We also have non-COVID cases. And I'm talking, if you have to talk about the emergencies, we will see probably about 100 non-COVID emergencies in a day too. So, I mean, think about it. It's very difficult to take care of that amount of patients with the same level of expectation and the same level of efficiency and effectiveness pre-pandemic compared to the pandemic and whilst we're in the pandemic. And of course, expectations from the public has not decreased. Everyone expects us to function under all of those circumstances as per normal. It can't happen. I mean, there are times when patients and relatives expect us to give them a brief every hour about their situation, their lab results, things they're waiting on. And majority of these things, whilst we would like to do that pre-pandemic, we were able to do it a bit better. Now it's challenging because there isn't time to actually speak with people. There aren't the time that you have to speak with people as much as you used to pre-pandemic, and it's a challenge because you take a lot of abuse with, and then sometimes it's one of the demoralizing aspect of the job. A lot of abuse. We're coping with quite a lot of abuse from family and relatives and complaints about not knowing what's going on. But you know, the reality of it is you're in a pandemic, and you don't want to bring people into an environment that's highly infective just to talk with them when you don't have the time to talk to them. If you have to choose, you got to just spend the time resuscitating people, trying to save life, than actually trying to speak with persons. So yeah, tough time, but we're doing the best we can.
In terms of your staffing, you mentioned having like 150 COVID cases and 100 emergency persons who line up at the emergency, because some of them don't do emergency, we know this, but some of them line up there for care. What is the staff in comparison to the staff complement in comparison to those persons seeking care?
So as I said before, it's the same number of nurses and doctors, more or less, probably a little less than before the pandemic started. So we have not been able to increase our staff complement. I'll get to that in a bit, but if I had to get more accurate with the description, I'm talking that we're seeing 100 non-COVID cases and close to 30 to 50 COVID cases at the hospital, but there are also about maybe another 80 to 100 persons who still present for care, but we have to route them to other areas because they think that, I mean, their leg pain is an emergency and those kind of things. So we still have to take care of those people, check their vitals, educate them, and get them to the outpatient section of the hospital, which takes time and takes away from taking care of patients. So that's one of the things, as you asked, we like to urge persons. This is a very challenging time for us, and if you don't have an emergency, it will help you and help us if you go to the outpatient clinics or the outpatient departments in the hospital. Because coming to the emergency department without an emergency is not the best place for you currently. In terms of staff complements, in terms of doctors, the issue is not the ratio as per se, is the workload. What took 20 minutes to do for one patient before COVID now takes about 40 minutes, because I'll give you an example. There are patients who come in with COVID. We have to put on our gowns, go and see them, put on our masks, go and see them, take care of them, resuscitate them. And COVID patients take longer to manage than a regular patient because of the infection control challenges that you have and the space that you have to manage them in. So it takes longer to see that person. Then you just have to take off your gown, come back and see that person with a heart attack, and then go back in and see another COVID. So you're just switching from one environment to the next, speaking with different persons with either COVID or non-COVID cases. And because of that, it has added a lot of time more to taking care of patients. And that is the biggest challenge, is that quite a lot of these things are avoidable. And the ones that are coming are largely unvaccinated persons who made that choice for whatever reason, but because of their choice, it's affecting us from taking care of the persons who didn't have a choice and came in because they were getting a heart attack or they were getting some amount of stroke or whatever their condition is. So challenging to say that a ratio of patients to staff, because it will not be acceptable. Pre-pandemic numbers is fine. In pre-pandemic numbers, you would say one doctor to probably about 10 patients. Now, in the pandemic, it's difficult to maintain that.
So we're talking about the Delta variant. Is there a specific test that medical people do, the doctors and nurses do, to determine which variant they're dealing with, or you just treat everyone the same way and try to figure out as well?
In Guyana, we do not do genetic sequencing to see what strain is there, but I mean, a wise person will obviously understand that we are in a surge, which is very similar to surges that would have occurred from the Delta variant, and it is expected. So we treat everyone as obviously a COVID-19 case, but the anticipation and expectation currently is that everybody that are coming with a severe form has the Delta variant, and we treat them as such. In terms of management, it's not as different. There's much difference when it comes to the management. But the fact is, it will be very unwise to just say that patients that are presenting are Delta or Alpha or whatever the case. You just treat them as COVID-19 and treat them at the stage where they are in the COVID-19 infection.
People may want to know, how is it that we've had COVID? What was it with these strains? How come the virus is able to mutate? Can you explain to them how that happens?
Right, and that is what virus does. A virus, what they do is basically they use us. We're as hosts, they get into our body. They use our cells to make more of them, and multiply so that they can spread more. So they use us as hosts to, one, multiply, and two, to spread to others so that they can multiply even more. Ever so often, there is what we call a mistake in how the virus transmits its information to our body. And when that mistake occur, that virus, a new form or a mutation of the virus is formed in our body. Every day, thousands of mutations occur with the coronavirus. Majority of them are not significant. They're weaker. And if you have to look at the trend in viruses during pandemic and viruses as a whole, what happens over time is initially they get more infectious. Sometimes they may get more deadly. But the trend is that for a naturally occurring virus, not one that was man-made or created in a lab, for a naturally occurring virus will tend to, whilst it mutates over time, get less infectious and less deadly in time. So as they mutate, and the expectation with this, anticipating that it is a naturally occurring virus, the SARS-CoV-2, the anticipation of this is that whilst it will mutate for a period and get stronger and more infectious, it will start to wane. And my take, this is my belief, is that we're in the last wave of the more infectious variants. As time goes by, the variants then will tend to get weak. And so, as I said before, thousands and thousands of mutations, but ever so often, one of them become a variant of interest, meaning that it can be more infectious or more deadly. However, after studying it and realizing that it can be rapidly spread and be a threat to the population, that is when it becomes a variant of concern, like what is occurring with the Delta strain. So the anticipation is that, and experts are also pronouncing on this, is that this may be the last hurrah for it, but let's see. Hopefully we're not sure, because we're anticipating based on trends before in pandemic. This is what happens. You get a few waves, and then you have the last of the big waves, and then it tends to die out. That is if it's a naturally occurring virus.
So you touched on my next question, because I was going to ask if there's anything we can do if there is a possibility of the virus mutating to another level. We don't know which level it will be now. The next level, what they would call it. But what can we do as a population to stop that, if there's anything that we can?
Yeah, there is right now they have one called a mu variant. That is one that is recently being discovered, and it's now a variant of interest. So it has not reached a level of variant of concern. But what the trends are so far with it is that it doesn't seem that it's spreading rapidly through populations, and that is a good indication that it may be weakening a bit. I don't want to pronounce too much or get too excited with that, but that's a sign. However, when it comes to virus and their spread and how they're disseminated, we're the ones they're using. Basically, they're using us to get what they want out of us, which is basically use you, multiply, and then kill you and leave you and move on, and just leave a trail of dead persons or people who are pretty sick and recovering with a lot of mental health and other complications, things that we call long COVID. What we can do to stop this here is prevent ourselves from either getting it or protect ourselves as much as possible, so that if we do get it, we do not transmit it to others as effectively. So the prevention methods are the most important thing. Can't say about the mask. right? Mask, you put it on your mask, you will basically prevent yourself from spreading any infection to others, and and also decrease your risk of getting it. What they found is that the Delta variant is sneaks through cloth mask, cotton-based mask, and even the surgical mask more efficiently than before. So your chances, for instance, with a regular surgical mask, if you're speaking with someone who's infected with the Delta variant, probably would have been about 60 to 70% chance of protection before. Now it is probably 50 or less. So it's sneaking through the regular surgical mask. If you think you're safe speaking with someone who doesn't have a mask on and you're close and you think you're protected with surgical mask, really and truly you're not with the Delta variant. So what they're saying is that if ensure both persons are masked. The second thing is that if you have surgical mask, if you can use two and it's comfortable for you, better. Or you take basically a cloth mask and put it over your surgical mask, so it gives it a tighter fit and prevents the virus from getting into you more efficiently. The other aspects of it is that you be more responsible with your behavior. Don't choose environments that the virus thrives easier. And this is an important thing. This is very obvious now. The virus tends to spread in closed spaces with poor air circulation or air transmission. So if you want to do your interaction, what the recommendations are, try to do it in open spaces where there's free flowing of air. So when you speak or someone speaks who is infected, it disseminates very quickly. If you're in a closed space where it's AC, the virus will be airborne for a bit and continue to circulate. And the chances of it getting into someone's nostril or getting landing on a surface where you can get infected increases. So you choose your environment wisely. And of course, you be responsible. Now is not the time to be going to bars and partying and being in those kind of environments. I'm not saying that there should be a lockdown, because there's a need for society to try it. But at the same time, we got to be very smart with the environments we choose. You get what you need to get done to make sure you're sustaining yourself, but do it in constructive spaces. And if you want to have a good time, do it in environments where people you're that are trustworthy and you know, like family who you're living with. Do it with them at home. Try not to go to the spaces where the spread increases. I mean, I'll give you an example. I don't want to hit on any category of the industry, but don't go into a restaurant that's closed, that's crowded with a lot of people, and take your mask off and eat and expect and get shocked when you get COVID. Those are the environments that the virus thrives quite a lot. So again, if you really and truly want to help decrease the spread of the variant, choose the right space and the right environment. Ensure you're masked up. Of course, do the rest of the prevention measures and definitely get vaccinated.
All right, we'll take a short break, and then we'll talk about vaccination in the whole aspect of dealing with the Delta variant. Welcome back to Your Health Matters here on Kaieteur Radio. I'm your host, Rihanna Ramsey, and we are talking to Dr. Zulfikar Box, the head of the emergency medicine at the Georgetown Public Hospital. He's talking to us about the Delta variant and what we should expect and how we should protect ourselves. And basically, he's telling us about being vaccinated. So let's talk about the vaccine, Dr. Box. How effective is the vaccine against this variant?
Extremely. The data has been there, and I mean, obviously there are different vaccines. The level of efficacy varies according to the type of vaccines. But if you look at the evidence of the ones that we're getting in Guyana, they're very effective in preventing hospitalizations and deaths. No vaccine will ever be foolproof, but they're very good enough to make sure that you're alive to survive this pandemic. So in terms of the efficacy of the vaccines, whilst they would have probably dropped a slight bit, and I say a slight bit, maybe about 5 to 10% the most, they're extremely effective still in preventing people from dying or getting hospitalized against the new form of the coronavirus called the Delta strain.
Well, for some persons who may say, okay, the vaccines, they aren't protecting us against getting the virus or spreading. How do you address those persons who are still hesitant and talking stuff like, oh, it doesn't prevent you from getting the virus? Why take it?
And that baffles me, because I mean, you do come across people like those, and I'm at a loss to try to understand I do try to understand why people are still so scared of vaccines. And I know there's a lot of it on social media. And I think we're in the time of social media where people are more focused on just scrolling through a phone and reading headlines. And sometimes these headlines over time, they infiltrate their thought process and causes quite a lot of scare. And I think that is anti-vaxxers and persons who probably have agendas would have used social media to scare quite a lot of people. And a lot of persons are scared of vaccines that they would have been taken since in their childhood, and they didn't have any problem. Most of these vaccines that are developed would have used the same technology that we're using for vaccines that we took and we're taking during childhood vaccines. So really and truly, it's no big thing that there are microchips and those kind of things in the vaccines. It's the same technology that we used to develop vaccines before, same ones now. And I know people are scared and worried about the COVID-19 vaccines. My thoughts to you are you need to speak with persons that are educated, that are informed, would have studied these things, and have the experience to understand how they work. Do not use Facebook, do not use those social media sites as your reference. Use reputable sources to get information. And don't be a headline reader. Be someone, if you can't read data and understand it as much as you can, right? Utilize the sources that are available very widely in Guyana. An example is what Kaieteur News is doing, and Kaieteur News has been one of the entities that's been promoting quite a lot of information about COVID-19, and that's been very accurate, and more so quite a lot of the other media houses. But aside from media houses, everyone knows doctors these days. And I'm talking about responsible doctors, because we do have irresponsible doctors, like every other field of practice. Get to those persons, speak with them, speak with persons who you know have had a history of being responsible and has had a history of giving you accurate information. Get their thoughts on it. Do not just jump to conclusion based on a social media post, right? Because as I'll tell, what I'll tell you is that majority of these things that are posted right now is with persons who have an agenda to basically prevent you from getting the information that will help to save your life. So I don't have a clear-cut answer to that question, but I think that's the best I can do, because everyone has a different reason why they're not wanting to take the vaccine. And it's best to consult with the sites or the persons who will be able to help you, given that are more informed to give you that decision, to help you with that decision.
And keeping on the point of vaccine hesitancy, there are some persons who are looking at the fact that some persons who were fully vaccinated, they still succumb to COVID-19 or complications as a result of, well, COVID-19. How do you address their concerns? Because they're saying, okay, what's the point of getting vaccinated if we can still die? How do you do
Yeah, and that's a good question, because indeed there's a very small percentage of person, but I think the best model to look at, to compare, is look at yourself as someone who's, and look at with another person next to you. That person next to you is fully armored. They have full body metal armor from head to toe. Obviously, between the joints, you'll have some small spaces, and you're basically standing up with no armor. And then there are about 1,000 persons shooting arrows to both of you. The person with the armor, right? Chances of getting hit with an arrow and dying is what? Extremely, extremely low. You, on the other hand, you are at a high risk, because if 1,000 arrow is coming at you, there's a decent number that will hit you because you don't have any form of protection. Chances of it hitting your leg and you living, it's the reality of what's happening with COVID, but there's a high chance of it hitting you in a vital area and killing you. Now, once in a while, an arrow may penetrate that person with the armor through maybe one of the small creases between the joint and hit his arm, but he still wouldn't die from that. Maybe even rare, that person might hit the blood vessel and they might bleed out and die. But what is the likelihood of that happening? extremely low compared to you, who's basically exposed with no protection. So in making it very simple, the person with the armor is the one who's vaccinated. The person who does not have an armor on is the one who's unvaccinated. Now, can you, as the person who's unvaccinated, laugh at the person who has their armor on and probably it went through a small hole and hit them, say that, oh, look, you also got hit? No, you can't, because the reality of it is the odds are of them getting hit and dying is so low that you should join them and put on an armor instead of laughing and making fun and say, or comparing and saying, you got hit, you're gonna die from it, or if you get hit, I can get hit if I put on an armor. Odds and the risk are so low that you should join that club instead of actually making a mockery out of it, which of course regularly actually.
Yeah.
I think that's the best model to let people understand the importance of vaccines and the protection they offer.
Yeah, that's a good example. In terms, we spoke about the mutation of the virus. You said that viruses, they feed off of us. They basically use us to basically study us and then mutate into another form so that they can continue living. Should we be worried about, given the whole issue of mutation, worried or concerned, not worried, concerned that we will have to take another vaccine or something to prevent ourselves? Do you see us going down that road, or not just another vaccine, but is it possible for the vaccine basically? Do you see us having to concern ourselves with more vaccine? And how long does this one, is there a time stamp for this one to be effective in our bodies? The ones that we're now getting.
The debate still is out on that. What I'll tell you is persons who have been vaccinated we've started vaccination back in March, I think.
Mm-hmm.
So it's more than 6 months. And I'm seeing both ends of the spectrum. Our deaths, 97% of our deaths are unvaccinated at this stage. 97%. So 3% of the persons who would have died are already vaccinated. So obviously an overwhelming majority of persons that are dying are the ones that are unvaccinated. So at this stage, the vaccines are working very fine and very efficiently. There are debates that it may wane over time, but we have not reached that period to make that decision as yet. People who are fully vaccinated have extremely great protection against dying and hospitalization at this stage. In terms of the persons that would have died who are vaccinated, they would have had quite a lot of other medical condition that made their infection more complicated. So I wouldn't want to blame the vaccine to say as much. And of course, in a few months, we'll get an idea where we're going. And then I think at that stage, a pronouncement will be made if people need boosters. However, where we're going depends a lot on us as human beings. The more we wait to get vaccinated and the more persons that are unvaccinated, higher the likelihood that this virus will mutate into vaccine-resistant strains, and then we'll have to develop vaccines for the newer strains. So kind of a way, it's a race. And at this stage, the virus is in front. The only way we can get in front and prevent this virus from getting into vaccine-resistant strain is to vaccinate the population extremely quickly before this virus figures out what's going on with the vaccinated people and figure out a way to form strains that are resistant to vaccine. If that happens, then we're gonna have to continue with vaccine. And I think what will happen over time, it will end up weakening to the form of maybe a flu, where you get yearly flu epidemics, or you have surges in the flu and you have to get vaccines to protect against it. That is where I think we're heading with the amount of vaccine hesitancy we have. However, if there's a miraculous turnaround and everybody decides to take vaccines, I think we'll stop it quite a bit in its tracks to prevent it from mutating. How likely that's going to happen? I don't think so, because there's enough worldwide hesitancy when it comes to vaccines, and I think the virus will win this race, and we'll have to live with it for the rest of our lives like we do with the flu.
we're in the process of immunizing children, and this is a touchy subject. A lot of parents are concerned. Some of them are basically in protest of having their children vaccinated. How do you quell their concerns? How do you make them a little bit more comfortable in terms of getting their children immunized for school or for just normal living?
Well, the first thing is that, as I said before, vaccines that are out there for COVID-19 have used the technology that is existing. So the vaccine that your children are receiving from birth and going to the health center where the nurses are giving them, it's a similar technology. Nothing has changed much. The only thing that has changed is that they've adapted it to respond to a different form of virus. That's all. Like if you have the measles virus and they give you the MMR vaccine, now they've modified it using the same technology and they're giving that vaccine for COVID-19. So it's not anything different. It's just a new form of technology. I know people are saying that it would have been expedited, but this the reason why it's expedited is not that there was any skip in steps in terms of safety. It's because one, they had an existing technology that they could have utilized. So that made it easier instead of having to invent something which takes years. And secondly, is that when the world is focused on getting something done and the funding for it is there, it will be done more efficiently. And that is what happened because this pandemic has threatened the entire world. So funding for the vaccine development and to get it through the stages was not difficult. It was very easy to get that done because the entire world was a threat. Other vaccines, it's difficult to get funding to do different stages. And whilst you have to apply for those funding and stuff like that, it takes time. And in addition to that, is that there are numerous companies who would have teamed up to ensure that these vaccines are delivered in large scales and made. So whilst one was working on this stage, the other one was working on that stage. So those are the kind of things that would have made it more efficient and made it easier to get it in such a short period. So there isn't anything to say there were skip steps. And it's simple. It's a similar vaccines that what your kids were taking all the time. It's a similar one. And I mean, if you look at worldwide data, there isn't any, as per se, to say that their death rates have been higher from that vaccine compared to others. It's just that social media and media as a whole has reported things in such a sensational way that it is registering more in minds than it used to with other things. And I'll give you an example. I mean, I'm talking to members of the public. Birth control pills. I'm not sure if many people know that they cause cancer. I'm not sure if many people know that they cause blood clots. I'm not sure if people know that people die from it because of using it. But does that stop people from using it? No, because the overwhelming majority of people do not have those occurrences. And the same thing if I was to take Panadol or paracetamol, which everybody uses, and give 10 million people, there will be somebody who has a poor reaction to it anywhere. And that is the reality of any medication or any vaccine. The unfortunate thing is that it gets sensationalized to the point where it scares people. And that is what is happening with these COVID-19 vaccine. It's not that they're causing an abundant amount of deaths or complication. And I'm yet to see a death from vaccines that were given in Guyana. And this is my personal belief, based on the science, is that Guyana has one of the most successful vaccination system in the world. Not for COVID-19 I'm talking about before this. And I think because of that, our body would have been accustomed to a vaccination system, and that prepares us and our immune system to respond more or respond less severely to vaccines than other areas in the world where people's body are not accustomed to vaccines and they're taking it for the first time, and they're getting more severe reactions and those other aspects of it. So I think that's why in Guyana we would have not had that amount of complication or that amount of deaths from vaccines, because our body are prime. We've done so many vaccines when we were kids growing up. Our bodies are prime and we're not getting those reactions. So rest assured that I don't think that there will be such an issue with vaccines and causing these kind of super deaths and these kind of super sicknesses that people are talking about. I haven't seen one as yet.
So we are just seeing like regular reaction to vaccination. Like it was like
right. And I don't want to say reaction. I guess because I know so much when it comes to those things as a medical professional, I was excited when I was getting symptoms from the vaccine, when I was getting my fever and body pains, because what that means is that my body was responding and forming antibodies to this vaccine. And if my body is forming antibodies, then I'm getting protection. So I do not look at it as side effect. I look at it as a positive effect. So it is expected that you will get something if you that means that your body is forming a response. So a good measurement is know that your body is forming a response and you're gonna get protection is that you will get some amount of symptoms.
Okay. In terms of before you go for the vaccine, I know there is a process. You consult with your doctor or you consult with the medical people there administering the vaccine. What can persons expect? Is there any difference given now that we're dealing with a higher variant, the Delta variant?
Please repeat. I didn't get that one. Sorry, Rihanna.
Sorry. I was saying that given that you're dealing with a higher variant, and we know that before you're given the vaccine, there's a normal process of going through if you have any
pre-existing conditions.
Yes, pre-existing conditions and all of that. Is there any difference given that we're dealing with the Delta variant now?
No, there isn't. The vaccines remain the same and they do the same thing. If you're not sure, consult with your physician. But reality of it is that if you would have taken vaccines when you were a kid, you should be fine to take vaccines now, unless something would have drastically changed in your health that your doctor should make that decision. However, if you have a health condition that makes you prone to picking up infection and make you more at risk of getting infections, then you're one of the prime candidates for that virus to kill. So make sure you get your vaccines. You're one of the persons that should try to protect yourself from the vaccine, because those are the persons that tend to die from it. So if you had your vaccines during childhood, then chances of you getting any issues with this one are pretty low or close to zero. So that's a good marker. But if you would have had a change in your condition that is so drastic that you think that you need a second opinion, please consult with your doctor to make sure. But there are very, very few conditions that you will probably have that prevents you from getting vaccines.
In terms of the immune, we know besides the vaccine, what else can persons do to stay healthy? We know we're told to wear a mask, and you gave us a scenario earlier that the Delta variant doesn't care for mask. It is more able to penetrate that layer. What can we do in terms of like eating right or using supplements? Is there anything else that you recommend as a medical doctor?
Right. Just to add, I didn't add this in, but the Delta variant, the N95 masks are pretty good still against the Delta variant. So that's that it penetrates the other regular masks a bit easier, so you can double up. Yeah, when it comes to, a lot of people say boost immune system. It's not really boost, it's preparing your immune system. The more prepared your immune system is, or the more healthy it is, the likelier you will fight off the Delta or any form of the coronavirus. And the data has shown that the people that are healthier do better with the infection. So things you can do is obviously make sure you're well balanced with your diet. You're having a healthy lifestyle where you're exercising. You're not eating the junk foods. Junk foods tend to cause quite a lot of inflammatory response in your body. An inflammatory response is something that stresses your body quite a bit, and you don't want to have inflammatory response or a stressed body whilst you're going into a COVID-19 infection, because guess what? That is what COVID-19 does. It feeds on people who have a stressed body or inflamed body. I think COVID-19 has also exposed how unhealthy we are as a population, because it's feeding more on the unhealthy persons and killing them. So if your body is thriving on poor diets, you're at the risk of having a high inflammatory response. And when you get infected with COVID-19, guess what it does? It causes a hyper-inflammatory response in your body. And so persons who are inflamed already, it's basically just a fire started already for the COVID-19 infection. So make sure that you're eating the right things, your stress level is low, you're exercising, getting a lot of sleep, and of course, taking your vitamins. Vitamins are so important to decrease your inflammatory response, and they're called antioxidants for a reason, because they get rid of the bad things in your body that causes your body to become inflamed. And the big goal here is to decrease inflammation. Inflammation is what COVID does to you. Just causes your body to go into such a hyper-inflamed response that it cannot come out of it, and then you die from those kind of inflammatory changes. So as much as you want, make sure your immune system is prepared by doing the things I would have told you to do.
There's no specific like types of food, because I remember earlier when the virus first, the pandemic first started, they were talking about vitamin D, lots of vitamin D foods.
So in terms of what they found is that, and these are data from before the COVID-19, is that vitamin C, zinc, vitamin D, those are the things that are very good with respiratory type infections and help to decrease the duration of it and helps you to be more prepared to combat it. So getting foods that are high in vitamin C, high in zinc, and of course vitamin D will definitely be of benefit for you during this time. Or even if you want to use supplements, do not overdose on them, because overdosing on them will not serve any purpose to your body. It actually might be a little harm. Just use the regular required amounts. Or use food that are rich in them.
I know that you have your column here with Kaieteur News. You mentioned staying away from some of the sources on social media. What are some sources we can go and read up about the Delta variant, COVID-19? What are some websites or so on? Where can we go to garner information? Or locally, can we?
Well, the good thing is that, I mean, I'm not trying to promote mine but I've done a lot of work to try to get the right information out, because what I realized when this pandemic started is none of us were prepared, and it's something that I don't like to be in. And so I would have made sure that I did a lot of the work, and I continue to do a lot of work to stay ahead of this virus and the pandemic, to ensure that, you know what, I learn so that I can make sure that I pass it on to my patients. But at the same time, that information I try to pass on weekly in the columns to help persons to get information. In addition to that, the Ministry of Health would have obviously been posting regular articles and on different sites. So you can always visit the Ministry of Health site to get more information on COVID-19. You can also speak with responsible persons in the health profession that you are comfortable with for years and have established a history of being responsible and practicing in the proper way to get information in terms of COVID-19 and preventative measures. And there are quite a lot of sites that are on the internet. A few of them that comes to mind that I think that are very reputable, obviously, is the CDC website, the WHO website. They have the Mayo Clinic, also there's Healthline, and they have a few others. But I think we're at the state where access to information is readily available. The problem lies in not so much the information is there. I think the problem lies is how it's interpreted and the sites or the places that people are getting the wrong information from. And I think I want to make sure I talk about that, is that we've gone to a stage where quite a large amount of the population, instead of choosing to take information from responsible persons or responsible sites or reputable sites, they're more looking at a headline or a video on Facebook or a video on TikTok and making a decision if not to take vaccine from that, or making a decision if not to be masked from that. And that one video influences their decision. So what I would try to encourage persons to do is to try not to base your decision on COVID-19 or your vaccination from a social media site or a social media video. I've mentioned a few sites and I've mentioned the professionals that you can consult with. We've been doing that for years and it has been working quite a bit. Do not change because time has changed and you have access to information through a social media site that you think might be more reputable. I think we're in this pandemic still, and we're still fighting because of those misinformation that are being peddled there. So please try not to use those inaccurate mediums to make your decision on vaccination and COVID-19.
Just before we go, we're about to wrap up already. Could you just impress on our viewers and listeners, because we're streaming on Facebook Live, what we're dealing with and how we can best protect ourselves against this new variant, the Delta variant that is killing a lot of people. Just last week, I think we had about 36 deaths in a couple of days, and 100 and something cases, new cases, 200 and something new cases in a day of the infection. How do we do that? Could you just impress upon them once more?
So today, as I'm talking to you today, we would have recorded the most cases that we would have had since this pandemic started. I think it's about 330 new infections. So that gives you an idea where we're going. You know, the reality of it is that things are getting harder and people are getting more infected and people are dying. And we have not reached the peak of the Delta wave. I think we're probably about a week and a half or 2 weeks away from that. And it is going to get worse before it gets better. And what the worry is that it is going to break our health system. We're pushed to the limits in the medical field. We're doing things that goes beyond what we're supposed to do to try to save lives. Things that I don't want to mention in a public forum, but things that sacrifices our personal health, our emotional well-being to make sure that we save the lives that we can. But I'm worried that the time is coming where, like the rest of the world, and Guyana is no different. Sometimes people think that, you know what, Guyana is a super center when it comes to these kind of things. We're just like the rest of the world. And I'm worried that we're reaching that stage where people will die because they're not getting access to the type of healthcare that they need. And not because of the fault of any health worker, any manager, any decision maker, because of the fault of us as human beings not making the decisions that would have been correct to protect ourselves, or in the form of preventative measures, or in the form of vaccines. Listen, the evidence is there. I'm working in the front lines. I'm seeing what's going on. The persons that are dying and the persons that are sick are not the vaccinated people, it's the unvaccinated people. And if you see the regret in their eyes and how much they beg you to give them vaccines, and it hurts to see people punished. And I'm telling you this much, the punishment from the Delta variant seems to be quite a bit more, and it's hitting people more early than it has before. And we've been dealing with this for a while, and it still hurts more now, and it's still more of an emotional trauma in the health system to see the suffering people are going through, right? And it's going to get worse, and they're going to come a time if we're not careful, right? As much as we try to prepare, if people continue to be as slack as they are, where so many people will be infected that we can't take care of you. And it hurts me, and it will worry me if that happens, because that could have been prevented because of the treatment we would have been able to give them will not be able to be prevented anymore. So I'm urging you to please just get vaccinated and save yourself from this thing. It's spreading very easily, as I told you before. It's 2.5 times more easy to catch than any other strains before. So chances of persons getting infected, given the numbers of people that are infected currently in Guyana, is really high. So if you're vaccinated, at least you know the chances of dying or being hospitalized or overwhelming the system very low. And you'll be basically helping yourself, helping others, and helping the health workers to make sure that we can take care of the people that really need to be taken care of.
Thank you, Dr. Box. Thank you for sharing your time with us and telling us, sharing some insight on the Delta variant. For those who listened, I hope you're taking heed of what Dr. Box said. We're living in a pandemic. We're going down a road where the virus has mutated and it's on a higher level and it's spreading quite rapidly. So do what you can do to protect yourself. Get vaccinated, wear your mask. The N95 mask is the best one to protect against this variant. And just stay safe and keep your loved ones safe. Thank you for listening. Thank you for joining us on behalf of the Kaieteur Radio team. See you next time.